It's a pleasure to be with you. The title of this session is Environmental Public Health Practice, Part 6, Toxic Metals. There are no disclosures for this presentation. Objectives include review the relationship between the Comprehensive Environmental Response, Compensation, and Liability Act and the National Priorities List. Review the 4 categories in the classification of metals. Review common sources of heavy metal exposures. Review basic demographics related to heavy metal toxicity. Review arsenic, beryllium, cadmium, chromium, lead, mercury, and nickel that are listed on the major toxic metals with multiple effects list. Review copper, zinc, and iron from the list of essential metals that have potential for toxicity. Review aluminum from the list of metals used in medical therapy. Metallic compounds are dispersed in the environment and arise from natural and man-made sources. All humans are exposed to metals naturally deposited in the Earth's crust. Man-made sources of these metals come from smelters, coal-fired power plants, hazardous waste sites, contaminated food and water, and occupational exposures. The Agency for Toxic Substances and Disease Registry, ATSDR, and the Environmental Protection Agency, EPA, develops a rank order list of hazardous substances as required by CERCLA, the Comprehensive Environmental Response, Compensation, and Liability Act, that are commonly found at U.S. sites on the National Priorities List, NPL. The National Priorities List is a roster of sites across the United States and its territories that are considered national priorities due to known or threatened releases of hazardous substances, pollutants, or contaminants. The Hazardous Substances Priority List is revised every 2 years with an informal review resulting in minor revisions annually. The rank of this list is determined by a score utilizing algorithm scores that consider 3 components: frequency of occurrence at NPL sites, toxicity, and potential for human exposure at NPL sites. The Environmental Protection Agency, EPA, uses the NPL and the Hazardous Substance Priority List to guide further investigations and determine which sites require remedial action through the Superfund Amendments and Reauthorization Act, SARA. The Hazardous Substance Priority List is not a rank of the most toxic substances, but a priority based on potential for human exposure at NPL sites. There are a total of 275 substances on that list. This table lists the top 20. The top 3 substances based on the 2022 algorithm score are arsenic, lead, and mercury. Another way to classify metals is to consider their toxicity potential based on 4 categories: major toxic metals with multiple effects, essential metals with potential for toxicity, metals related to medical therapy, and minor toxic metals. Let's review the lists in those 4 categories. Major toxic metals with multiple effects include arsenic, beryllium, cadmium, chromium, lead, mercury, and nickel. These are heavy metals that are toxic to living organisms and not necessary to sustain life. This group of metals are not only toxic at low concentrations, but can bioaccumulate. For example, lower water organisms may ingest mercury compounds. These organisms are consumed by snails, then subsequently by small fish, and then larger fish that are harvested for human consumption. Mercury becomes more concentrated at each stage of this food chain. Another example of bioaccumulation is heavy metal in zebra mussels in the Great Lakes. These mussels filter out and concentrate heavy metals in their bodies, and when eaten by other fish or wildlife, cause heavy metal toxicity. Essential metals with potential for toxicity include cobalt, trivalent chromium, copper, iron, magnesium, manganese, molybdenum, selenium, and zinc. These metals are essential for life when present in trace amounts. Metal related to medical therapy include aluminum, bismuth, gallium, gold, lithium, and platinum. For example, lithium is used to treat clinical depression. Minor toxic metals include antimony, barium, germanium, indium, silver, tellurium, thallium, tin, titanium, uranium, and vanadium. There are several potential ways humans are exposed to metals, including inhalation, skin contact, and ingestion. This table demonstrates that the sources of exposure vary based on the metal. For arsenic, water is the most common relevant source of exposure. For mercury, soil dust, water, and biota in food, including bioaccumulation in fish, are most common. For iron, mining and rust in pipes are relevant exposures. For lead, smelters, leaded gas, toddler ingestion, drinking water from lead pipes, and eating food from lead glazed pottery and certain contaminated food sources. For example, paprika from Hungary in the 1990s was a source of lead intoxication, with lead being used to improve the color of the spice. Other common sources of environmental heavy metals include tires and electronic equipment. Globally, millions of used tires, which contain zinc, cadmium, and lead, are discarded annually into landfills. Also, due to limited recycling facilities, electronic equipment is often deposited in landfills. For example, fluorescent light bulbs, lithium ion batteries, cell phones, computers, computer monitors, television sets, etc. These devices contain lead, mercury, cadmium, chromium, lithium, arsenic, copper, and zinc. From these landfills, heavy metals are released into the soil and may enter the groundwater. Acute poisoning from heavy metal high dose exposures is usually severe and dramatic, with rapid onset of symptoms, often within a few minutes to an hour. Acute poisoning can present with vomiting, abdominal pain, headache, decreased respiration, and seizures. One source of acute heavy metal poisoning is contaminated food from the leaching of metals into food during the cooking process, or due to errors in food manufacturing or handling. For example, methyl mercury contamination of grain used to make bread in Iraq resulted in more than 6,000 hospitalizations and 500 deaths. Methyl mercury was used as a fungicide to treat grain meant for planting. Unfortunately, this grain was instead used to make flour. Long-term exposures to heavy metals often mimic the symptoms of many chronic medical conditions associated with reduced cognition, learning impairment, and lethargy. These symptoms often present with a remission pattern that may prevent affected individuals from seeking medical care. Women are more susceptible to heavy metal toxicity than men due to several factors, including hormonal and metabolic processes associated with menstruation, pregnancy, and menopause, and smaller body size. Women accumulate higher concentrations of cadmium and lead and are more likely to develop skin allergies to nickel than men. Children are more susceptible to heavy metal toxicity due to a lower body weight, which can result in damage to various body organs, including the nervous system, and increase risks for a variety of cancers later in life. Many of these effects may be irreversible. Lead and mercury exposure during pregnancy is particularly hazardous for the neurodevelopment of the fetus. Nervous system damage from heavy metals include memory loss, learning difficulties, hyperactivity, and aggressive behavior. For example, the doubling of blood lead levels from 10 to 20 micrograms per deciliter increases a child's need for special education services by 60%. As of October 28, 2021, CDC uses a blood lead reference value of 3.5 micrograms per deciliter to identify children with blood lead levels that are higher than 97.5% of children's levels in the United States. Let's now consider the major toxic metals with multiple effects: arsenic, beryllium, cadmium, chromium, lead, mercury, and nickel. Arsenic is a nearly tasteless, odorless element and is ubiquitous in soil and water. Other sources of arsenic include industrial sources, for example, smelting processes, coal-fired power plants, metal alloy production, purification of industrial gases. Arsenic-containing products, for example, insecticides, algicides, wood preservatives, cancer drugs, traditional medicines, equipment, for example, microwave equipment, lasers, light-emitting diodes, photoelectric cells, semiconductors, and foods, for example, clams, oysters, scallops, mussels, crabs, lobsters, bottom-eating fish, seaweed, etc. The EPA arsenic drinking water standard is 10 parts per billion, or 10 micrograms per liter. Drinking water levels of arsenic up to 1,000 micrograms per liter are found in areas of Taiwan, Mexico, Chile, Argentina, Bangladesh, and Mongolia. In the United States, higher arsenic drinking water levels are seen in areas of New Mexico, Arizona, Nevada, Utah, Southern California, Idaho, and Nebraska, with levels ranging from 50 to 100 micrograms per liter. The map on this slide shows the arsenic concentrations in groundwater of select sites in the United States. Generally, ingestion of 100 milligrams of arsenic produces acute poisoning with symptoms of nausea, vomiting, and diarrhea that begin within minutes to hours of ingestion. The diarrhea is often described as rice water, like cholera, and may contain blood. Other symptoms of acute toxicity may include hypotension, electrocardiogram abnormalities, cough, difficulty breathing, chest pain, pulmonary edema, acute renal failure, headache, delirium, and seizures. Arsenic in drinking water during pregnancy is associated with increased spontaneous abortions, stillbirths, and preterm deliveries. Subacute arsenic toxicity is seen 1 to 3 weeks after exposure and associated with reversible sensory-motor polyneuropathy, dysesthesia or unusual sensations of the hands and feet, weakness, gait disturbances, headache, confusion, memory loss, delirium, and seizures. A wide range of hematologic abnormalities, including anemia, leukopenia, and thrombocytopenia, can be seen with subacute arsenic poisoning. Chronic arsenic poisoning is often associated with dermatologic signs, including diffuse, spotted hyperpigmentation of the skin called melanosis, occurring 6 months to 3 years after exposure. Meese lines, or transverse white lines across fingernails, may be seen 4 to 6 weeks after exposure. Other chronic symptoms and signs include hyperkeratosis of the palms and soles, eczema-like rashes, warts, and alopecia, hepatomegaly, ascites, and nonspecific abdominal pain. Arsenic poisoning has been linked with skin cancers of the hands, lung, and bladder, and angiosarcoma of the liver. These pictures demonstrate the melanosis and Meese lines associated with chronic arsenic poisoning. Additional potential health effects of chronic arsenic poisoning include peripheral vascular disease, cerebrovascular disease, hypertension, and diabetes. Beryllium is widely used in industry since it is lighter than aluminum, stronger than steel, and can be alloyed with other metals like copper, forming a high-strength alloy. Sources of exposure include the metal processing industry, burning of coal, and contaminated agricultural products. Beryllium inhalation exposure can result in a debilitating and sometimes fatal pulmonary disease called berylliosis, also known as chronic beryllium disease, CBD. Symptoms include fever, dry cough, occasionally associated with blood-tinged sputum, chest pain, shortness of breath, fatigue, weight loss, and joint pain. Development of CBD is affected by not only exposure to the metal, but also a genetic susceptibility, a glutamic acid residue at position E69 of the HLA-DP beta chain. Beryllium is classified as a Group A carcinogen. This table lists the ATSDR carcinogen classification system. Group A substances have adequate data to demonstrate a causal relationship to human cancer. Group B substances are probable, and Group C possible carcinogens. Group D substances lack adequate data to determine whether the substance is carcinogenic or not. And Group E substances have data from animal studies that demonstrate no evidence of carcinogenicity. So once again, beryllium is a Group A carcinogen. Cadmium is found in soil, rocks, and coal. In nature, cadmium is usually combined with other elements, for example, oxygen, forming cadmium oxide. Due to absorption from the environment, cadmium is also found in shellfish, fish, plants, mushrooms, and animals. Industrial sources of cadmium include mining, smelting of zinc ores, iron and steel production, coal-fired power plants, fertilizer and pesticide manufacturing, nickel-cadmium battery production, and soldering. Other sources of cadmium include cigarette smoke and food, for example, vegetables. The soil of gardens near battery factories are often contaminated with cadmium. Cadmium toxic exposures are primarily through inhalation and secondarily through the gastrointestinal tract. Potential health effects associated with cadmium toxicity include kidney damage, bone disease, for example, osteoporosis, cancer, for example, prostate and lung, cardiovascular disease, for example, hypertension and circulatory problems, and reproductive toxicity, including genotoxicity or the ability of cadmium to damage DNA, resulting in birth defects. Cadmium was shown to cause Itai disease in Japan in 1912, caused by cadmium contamination of the Jinzu River by the Kamioka Mining Company located upstream. Afflicted individuals, mostly women, experienced severe total body pain, and would cry out, "Atai!" There are three common forms of chromium: chromium 0, chromium 3, and chromium 6. Chromium 6 is also called hexavalent chromium. Chromium 3 is the natural form and is considered an essential nutrient found in food. Chromium 3 is required in trace amounts to enhance insulin action and aid in the absorption and metabolism of carbohydrates, fats, and proteins. Chromium 0 and 6 are the result of human activity and are widespread environmental pollutants. Chromium is a naturally occurring element in rock, soil, and materials of volcanic origin. Sources of exposure include occupational exposure and ingestion of food and water. Occupational exposure is usually by inhalation, which is associated with more toxicity versus ingestion of food and water. Health effects of chromium intoxication include lung cancer, digestive problems, kidney and liver damage, skin ulcers through skin contact, rhinorrhea, nosebleeds, and perforation of the nasal septum. The current federal drinking water standard for total chromium is 100 micrograms per liter, or 100 parts per billion, which includes both chromium 6 and chromium 3, since these forms of chromium can convert back and forth in water. The film Erin Brockovich, released in 2000, is a docudrama of Erin Brockovich, a lawyer who sued the Pacific Gas and Electric (PGE) company for releasing 370 million gallons of chromium 6 contaminated water into an on-lined pond. Chromium 6 leached into the drinking water of Hinckley, California, with total chromium levels measured at 580 micrograms per liter. Hinckley residents complained of health problems involving the liver, heart, respiratory, and reproductive systems, and various cancers. The plaintiffs won a $333 million settlement, along with an agreement that PGE would clean up the contamination. This was a controversial case, since many toxicologists claimed that the exposures were too low to cause health effects. Mercury is a naturally occurring metal that is highly toxic. It's found in three forms: organic mercury when combined with carbon, the most common of which is methyl mercury; metallic mercury in liquid form at room temperature, also called quicksilver; and inorganic mercury when compounded with other elements, for example, mercury oxide or mercury sulfide. Historically, mercury has been used as an agricultural fungicide, in dentistry as an amalgam to fill cavities, and medically to treat syphilis. Both inorganic and organic mercury can be absorbed from the gastrointestinal tract. Metallic mercury intoxication is usually associated with inhalation. When released into the environment and deposited in bodies of water, mercury is methylated by bacteria and fungi, and through the process of bioaccumulation as it moves up the food chain to fish, becomes a hazard to humans when consumed. Seafood at greatest risk of bioaccumulated mercury include shark, swordfish, tilefish, king mackerel, albacore tuna, and shellfish. Pregnant women and young children are at greatest risk for mercury poisoning and toxic complications. Fetuses can be exposed to methylmercury when their mothers eat contaminated fish and shellfish. This exposure can adversely affect the development of the fetal brain and nervous system, resulting in problems with cognition, memory, attention, language, fine motor skills, and visual spatial skills after birth. Methylmercury is a powerful neurotoxin, and people exposed to high levels may experience adverse health effects, which may include loss of peripheral vision, muscle weakness, numbness and tingling in the hands, feet, and around the mouth, impaired speech, hearing, coordination, and gait. Symptoms of severe methyl mercury poisoning were noted in approximately 3,000 individuals who ate fish contaminated by methyl mercury in Minamata Bay, Japan in 1956. The cause of Minamata disease was discharges of mercury compounds into the bay from a plastics factory. Symptoms included uncontrollable tremors, loss of motor control and muscle coordination, auditory and visual sensory loss, partial paralysis, and numbness of the hands and feet. Exposures to metallic mercury most often occur when metallic mercury is spilled or when products that contain metallic mercury break, aerosolizing or vaporizing some of the metallic liquid. Metallic mercury mainly causes health effects when inhaled and then absorbed through the lungs. Symptoms of mercury vapor intoxication include tremors, emotional changes, for example, mood swings, irritability, nervousness, excessive shyness, insomnia, neuromuscular changes, which include weakness, muscle atrophy with chronic exposures, twitching, headaches, disturbances in sensation and nerve responses, poor mental performance on tests and cognitive function. Metallic mercury vapor is not the same as methyl mercury. High exposures to inorganic mercury can result in damage to the gastrointestinal tract, the nervous system, and the kidneys. Symptoms of high exposures to inorganic mercury include skin rashes and dermatitis. For example, acrodynia or Pink's disease, as demonstrated on this slide, with redness and peeling of the extremities. Other symptoms include mood swings, memory loss, mental disturbances, and muscle weakness. The EPA set a maximum contaminant level MCL standard of 2 micrograms per liter, or 2 parts per billion, for mercury in drinking water. Drinking water containing inorganic mercury exceeding this standard for many years can result in kidney damage. Sources of lead include leaded gasoline that was used to improve the performance of combustion engines. Lead was used in paint before 1978 to increase the durability and adhesion of paint. Some of that paint was more than 50% lead. In 1975, leaded gas was outlawed in the United States, followed by leaded containing paint in 1978. Since 1978, blood lead levels in children have decreased dramatically. The National Health and Nutrition Examination Survey, NHANES, estimated that from 1976 to 1980, the prevalence of blood lead levels greater than 10 micrograms per deciliter in children under 6 years old was 80%. By 1999 to 2000, that prevalence had dropped to 2.2%. In 2021, the CDC reduced the blood lead level standard to 3.5 micrograms per deciliter. 2.5% of children less than or equal to 6 years old in the U.S. were at or above that level in 2021. Even though lead level standards are set, it's important to know that there is no safe blood lead level. Other common sources of lead include soldered pipes and cans and old plumbing fixtures. In old plumbing fixtures, lead was often added to brass to make it easier to machine into a smooth surface. Water sitting in those brass faucets for hours leach significant lead into the water. Lead-contaminated soil and dust is another lead source. Soil found near airports, highways, and factories is at higher risk. Workers exposed to lead materials can transfer lead via their clothing to their homes and children. Imported sources of lead can include pottery, candies, traditional medicines, toys, and jewelry. Pottery painted and or glazed with lead-containing materials can result in lead leaching into food or beverages. This slide lists a few imported traditional medicines that contain lead. As demonstrated, some of these medications like Greta and Azarcon that are used in Hispanic communities to treat gastrointestinal and teething symptoms can have a lead content as high as 90%. Cadmium is a common contaminant of lead-containing ores, so both lead and cadmium levels are evaluated when considering lead intoxication associated with ore processing plants. Lead is a potent neurotoxin and can damage the growing brain of children. Lead poisoning is a significant pediatric environmental health problem in the United States. A blood lead level of 70 micrograms per deciliter or greater is associated with severe neurologic effects, coma, and death. A blood lead level above 15 micrograms per deciliter is associated with maladaptive behaviors. Symptoms of lead toxicity in adults include headache, cramps, constipation, muscle and joint pain, high blood pressure, memory and concentration problems, mood disorders, reduced sperm count or abnormal sperm, and aggressive behavior. Numerous studies link elevated bone or blood lead levels with aggression, destructive and delinquent behavior, attention deficit hyperactivity disorder, and criminal behavior. Signs and symptoms of lead poisoning in children include developmental delay, learning difficulties, irritability, loss of appetite, weight loss, sluggishness, fatigue, abdominal pain, and vomiting. Every child should be screened for lead at 1 and 2 years of age. Nickel is a ubiquitous heavy metal found in the Earth's crust. Beneficial attributes of nickel include ease of machining and polishing. It resists corrosion. Nickel is used in the production of many appliances and tools and is a part of nickel-cadmium batteries. Nickel toxic exposures occur in workplaces through inhalation and skin contact. Current information suggests that low doses of nickel are unlikely to harm humans. Health effects include contact dermatitis due to nickel allergy, cardiovascular and renal diseases, pulmonary fibrosis, and nasal and lung cancers. Let's now consider a few essential metals that have potential for toxicity: copper, zinc, and iron. These three metals are essential for human nutrition in trace amounts, but can also be toxic and even fatal when individuals are exposed to high doses. Copper is present in the Earth's crust and is an essential nutrient that helps protect the cardiovascular system, promotes bone fracture and incisional wound healing, exerts antibacterial effects, and aids in the killing of cancer cells. Copper is used in electrical wires, pipes, as a mildew inhibitor, and wood and leather preservative. Sources of copper exposure include food, water, and industry. For example, smelting, mining, and waste disposal sites. Human exposure occurs via inhalation, the breathing of dust and fumes during mining, welding, and grinding. Exposure can also occur through ingestion and skin contact. When tap water stands in copper pipes for hours, small amounts of copper can dissolve into water, which may be associated with gastrointestinal symptoms. Running the water for 30 seconds can decrease the copper concentration in tap water. Health effects of copper intoxication include gastrointestinal symptoms of vomiting, diarrhea, nausea, and stomach cramps. High levels of intoxication can result in liver and renal disease and death. Inhalation of copper dust or fumes can cause irritation of the respiratory system. Zinc is a common element found in the Earth's crust, the air, soil, water, and most foods. Zinc is used as a coating to inhibit rust, a component of batteries, and in combination with other metals to make brass, bronze, and other alloys. Zinc as a nutrient is important for the growth and function of the skin, gastrointestinal, central nervous, skeletal, immune, and reproductive systems. Infants, children, adolescents, pregnant, and lactating women have increased requirements for zinc and thus are at increased risk of zinc depletion. Zinc deficiency during growth periods results in growth failure. Zinc deficiency is also associated with anorexia, a loss of taste, ageusia, and smell, anosmia, skin rashes, and may decrease immunity against common infections. Zinc toxicity relates to the route of exposure and the dose delivered. Acute toxicity differs significantly from chronic toxicity. Acute toxicity causes gastrointestinal symptoms, including hematemesis or vomiting blood, renal injury, acute respiratory distress syndrome, ARDS, or serious respiratory failure, liver necrosis, thrombocytopenia, coagulopathy, and even death. Exposure to zinc-containing fumes causes irritation and damage to the respiratory system, called metal fume fever. With chronic exposures, zinc toxicity causes bone marrow suppression and neurologic effects. Zinc intoxication increases metallothionein that decreases copper levels in the body. This combination of elevated zinc and decreased copper levels causes bone marrow suppression that may include sideroblastic anemia, granulocytopenia, and myelodysplastic syndrome, and an ascending sensory motor polyneuropathy syndrome. Iron is one of the most common metals in the Earth's crust. Iron is a vital nutrient for human health, necessary to produce hemoglobin and myoglobin, proteins that carry oxygen to the body. Iron also supports healthy connective tissue, physical growth, neurologic development, hormone synthesis, and immune system function. 66% of the body's iron is found in hemoglobin. Iron deficiency is associated with anemia, fatigue, and lowered immunity. Iron toxicity manifests as vomiting, diarrhea, intestinal damage, low blood pressure, lethargy, seizures, and brain and liver damage with a severe overdose. Children are at greatest risk of iron toxicity, often caused by accidental ingestion of iron-containing medications. Other groups at risk of iron intoxication include men and postmenopausal women. Let's now consider one metal associated with those used in medical therapy, aluminum. Aluminum is widely distributed in food, water, air, and soil. Uses of aluminum include food and beverage containers, pots and pans, construction materials, medicines, for example, antacids, vaccines, cosmetics, and antiperspirants. Human exposures can occur in workplaces that handle aluminum, aluminum mining and processing facilities, hazardous waste sites, use of medications and skin products, and ingestion of food and beverages. Very little aluminum enters the body through cooking utensils. Health effects include coughing and exacerbations of asthma when exposed to aluminum dust. Aluminum may be associated with the development of Alzheimer's disease, though that has not been confirmed. In summary, all humans are exposed to metals naturally deposited in the Earth's crust. There are several potential ways humans are exposed to metals, including through inhalation, skin contact, and ingestion. Women and children are more susceptible to metal exposures than men. Arsenic in drinking water during pregnancy is associated with increased spontaneous abortions, stillbirths, and preterm deliveries. Beryllium is classified as a group A carcinogen. Chromium 0 and 6 are the result of human activity and are widespread environmental pollutants. Methyl mercury is a powerful neurotoxin. Lead poisoning is a significant pediatric environmental health problem in the United States. Copper, zinc, and iron are essential for human nutrition in trace amounts but can also be toxic. Children are at greatest risk of iron toxicity, often caused by accidental ingestion of iron-containing medications. Aluminum may be associated with the development of Alzheimer's disease, though that has not been confirmed.